Welcome to Pure Mind Magic, the show to evolve your mind. Our mind is the most powerful thing we have, but no one teaches us how to use it. When we find out how, we're ready to create magic in life and in business. Learn real mindset secrets from brilliant minds around the world to change your mindset and income level forever. With every decision you make, you create your future. What is your next move? Now, welcome your host, international magician, speaker, and podcast performance consultant, Jennifer S. Royal.
Hi, this is Jennifer, and welcome back to a new episode. Today with a guest from actually Germany. You know, when you are very busy, especially when you are an entrepreneur and there's so much to do, it can be tricky sometimes to really stay healthy and have a healthy lifestyle, and also handling all the stress levels you are going through almost day and night. And sometimes this can really have a deep impact on your health, so that you're getting sick in some way or form. And my guest today is really special because he is actually a tinnitus coach. So he is helping people who have to deal with tinnitus and having this permanent sound in their ears that can be really annoying. And as we discussed, this can actually be caused by too much stress. So today's episode will give you some insights on how to live with that, what you can do when you face tinnitus, and also some other mindset tips and tricks from tinnitus coach from Berlin, Friede Kuehne. Friede, welcome to the show.
Yeah, thanks for having me, Jennifer. I'm very glad to be here.
Great. So it's really interesting to have someone from Germany as well today.
Yes, straight from Berlin. I was actually born in Freiburg in Germany, in the very south, close to Switzerland and France, but been in Berlin for about 5 years nearly now.
Great. And we have a very special topic actually today. So I have never spoken to a coach like you before. I've done a lot on personal development and business entrepreneurship, but you are a coach for tinnitus. So can you give us a short introduction about yourself, please?
Yes, for sure. Very happy to. As I said, I was born in Freiburg, very south of Germany. And I was born deaf on one ear. So my left ear has always been deaf and a bit of a problem. But I always had 100% hearing ability on my right ear. So I basically was able to cope pretty well, apart from the fact that I could, for example, never use directional hearing. So when my mom was screaming through the flats, Frida, come here. And I was like, where are you? Where are you? So, usually you would hear where that sound is coming from. I can't because I only have one healthy, in brackets, ear. That healthy ear, unfortunately, deteriorated in the time when I was a young teenager, started going to clubs. And about 15 years ago, no one would use hearing protection, and this is just a normal thing that you go into the club. It's just an insane amount of loud music and you stay there the whole night. And afterwards you get that little ringing, but usually it goes back to the background. That's maybe also the easiest way for the listeners out there to know what tinnitus actually is, that if you have been to a loud event, maybe a concert or something, and then afterwards that little ringing noise stays for maybe a day or just a couple of hours. But that is actually what in some people becomes chronic and called tinnitus, and quite an unpleasant phenomena for a lot of people.
Wow, what a story. So you kind of found your own way to cope with all of that. And I imagine it was not really easy as a kid and teenager later on to deal with that. So how did you manage your mindset around this?
Yeah, of course, in order to become a coach, I had to pretty much go through all parts of the struggle myself. My tinnitus first started when I was 18, 19, and it started as a very low noise. And eventually I went to the ENT, to the ear, nose, and throat doctor, and he said, oh, look, you do have a slight hearing loss already in your good ear, right? And this is the only sort of good ear that I have. And he said, yeah, you should be really careful. And there's a second important fact for people listening out there. So hearing loss is still the biggest causal link for tinnitus. So if you do develop some hearing loss early on, chances are very high that you also develop tinnitus. So protecting your hearing is one of the biggest preventative tools that you have in order to, avoid getting tinnitus. But yeah, for me, there was a lot of struggle involved. The usual journey for someone suffering from tinnitus is going to the ENT, getting it checked out, and the ENT says, you have tinnitus, but it's not dangerous, so stop worrying about it. And then he sends you back home. And many people, because it's a constant ringing in your ear, or some people perceive it in the head, it's very distracting. So especially when you, for example, want to sleep at night and you're used to complete silence, people get very distracted, and then this fight or flight instinct starts, vicious cycle, you're triggered. In that state, you definitely won't be able to go to sleep. And that's where the journey starts for many people with tinnitus. And I decided that after having dealt with it for so many different years, I worked in the hearing testing environment for a while. Did some courses in cognitive behavioral therapy. I'm not a licensed therapist myself here in Germany, but I have some training in that area. And decided to really use and employ the tools that we have out there, because other than tinnitus management strategies, which can be very, very efficient, we unfortunately do not have a complete cure to tinnitus yet.
Okay, so that was a lot of information, Frida, and maybe we can go to the point where, can you explain what affects tinnitus? So how does it start, or is there a way you can prevent it or do something for your health? And especially, what kind of role does stress play?
Yeah. Very interesting fact. So it's known that tinnitus is linked to hearing loss, as I said. So one of the biggest causes for tinnitus is hearing loss, but not everyone who has hearing loss develops tinnitus. It's known now as well in the scientific community that there are genetics that play a role, whether a person, I don't want to get into the technicalities because it involves the limbic system, the auditory cortex in the brain, and so on and so forth, but it's maybe a bit too technical to go into right now. But let's just say not everyone who has a hearing loss develops tinnitus, but if you do have a starting significant hearing loss, then the chances are higher that you develop tinnitus. Stress is playing a big role as well, because stress is also leading to inflammatory processes in your body. And it's also seen that hearing loss, so early onset hearing loss and signals of inflammation in the body can also lead to tinnitus. So it's often very individual. That's why I'm saying may and can and all these things, because it's very individual how and when and what the factors, the risk factors are for a person who does start suffering from tinnitus. And we know that hearing loss is a big driver. So really being mindful of the level of input of loud noises you have. This includes wearing AirPods the whole day and being on calls the whole day. So be mindful of that. But also going to concerts, loud events, bars not possible yet, but hopefully soon. So these are one of the biggest factors that lead to tinnitus, and you can prevent them in simply, protecting your hearing a bit better.
I understand. And I guess, Frida, that there is also no age tag to this, so it could happen anytime, right?
Yeah, it can happen anytime. You are very right. It is sometimes I see people coming to me, working with me, in especially the group between 30 and 45, when they are, especially as you said, stressed. So there is a stressful period in their life. Maybe stuff at work is very busy, or family issues, or a disease of a loved one, or something like that. So really intense stress, plus an onset hearing loss. So to say, someone who didn't really take care of the hearing before. So there is a very, very slight hearing loss. And together with the stress and some inflammation signals, that is causing tinnitus. But literally, like I said, I have tinnitus since I was 19, so for nearly 12 years now. But there are people who develop tinnitus much later and people who develop tinnitus much earlier. So there's really no age limit to it.
I see. So how do you deal with this on a daily basis when you have this since you are 19?
The good part is once you stop struggling with it, it frees up very, very nice amounts of energy. And this is actually also the assumption of cognitive behavioral therapy is you change your perspective. I like to make a comparison like this. Like if you are out in the forest, how many times when you're out in the forest is there complete silence? Actually, nearly never, right? So this construct that when we are in a room where no external sound is present, the tinnitus is bothersome or dangerous to us is, first of all, a socialization issue, because we know that, okay, tinnitus should be dangerous, and when I'm in a quiet room, it should be quiet. But to be very honest, the difficult and the most dangerous part with tinnitus, because tinnitus, the symptom is very unpleasant, but in 99% of the cases, the tinnitus has no organical underlying issue. So there are very, very few cases where people develop an acoustic neuroma, so a cancer in the inner ear, but this is very, very rare form of cancer. And in 99% of the cases, tinnitus is not dangerous. So what is much more dangerous is your reaction to it. So this constant tuning into it, hooking your attention on it, and then triggering this vicious cycle of attention and anxiety, and will it get worse in future? How can I live with this? I can't concentrate, I can't sleep, and so on and so forth. And the nice thing about a cycle is it really doesn't matter where you get out. So challenging these assumptions is one of the core, techniques that we have, and they're scientifically evaluated to work, as unfortunately we do not have other treatment methods to get rid of tinnitus completely.
But very good point, Frida. I think this goes for almost everything in life. So where you put your energy is what expands and what grows. So it really helps sometimes to take off the energy and also to release all the stress that is involved there. Yeah. So I just imagine it is really tough to, live with that in the first beginning. And when someone listening right now has to deal with this problem, how could you help them? So what does tinnitus coaching look like actually?
Yeah, for sure. So first of all, I think it's very, very crucially important to understand what tinnitus really is. And we just talked about it. So setting the picture straight, right? So for example, setting the understanding that it actually really is your thoughts that make up, let's say 80 to 90% of the struggle with tinnitus is your way to respond to it. So the first thing that we want to do is we usually start with an initial evaluation. So people come to me, they say like, hey, I have tinnitus, I would like to work with you. How can you help me? And I'm like, great, awesome. Let's schedule the call. But before the call, please complete this evaluation. And then we evaluate every single factor of when is the tinnitus triggered? What is the person most obsessed with? When is it the tinnitus most bothersome? For example, at night, or not even at night, because they manage to distract themselves at night with some rain sounds on the cell phone, or some people get a sound pillow. So there's possibilities. But we really meticulously identify the areas that are mostly affected in the person dealing with tinnitus, and then we come together for the first session. We evaluate all these different areas, and we create a 5-step action plan. So for many people, the anxiety issue is there. So worrying about the future, worrying about tinnitus as soon as they hear it. And, since you hear it all the time, it's very difficult to break that vicious cycle. But then we use another technology or another technique based on acceptance and commitment therapy. And that's, for example, is a very nice analogy, also used to treat spider phobia. In order to treat spider phobia, you basically have the person be with a spider in the same room. And with tinnitus, it's similar. So you said earlier on, whatever you put your energy into expands. But if you put that energy into, and you realize you put that energy into, and you let that energy flow freely, the energy exhausts itself as well, right? You probably also experienced that already. When we really sit down in the moment, and instead of, for example, running away from tinnitus in that particular moment, we sit down and we're like, oh wow, that's very difficult to be with. And this is a difficult task, but we do that basically in a controlled environment. And most of my clients report after 1 or 2 weeks of employing the technique of, for example, labeling a feeling. Let's say, oh, there's a tinnitus anxiety again, hashtag tinnitus anxiety. So as soon as you label it, you have an immediate response to that adrenaline, cortisol, fight or flight instinct that is basically signaling our brain that we are in danger. And as our brains got the last update 200,000 years ago, not like your new MacBook Pro, which is updated every couple of weeks or month, our brains are basically 200,000 years old. So when your brain perceives that you are in danger because you are tinnitus anxious, you're in a triggered state constantly, in a fight or flight instinct. And acceptance and commitment therapy, so really opening up to what is there and really for the first time giving yourself and your tinnitus the space to show what feelings are there, emotions associated with it, opens up a great possibility for you to counter that fight or flight instinct, and it's scientifically proven.
Very interesting how you described that. So when someone is really interested in working with you, where can they find more information about you and doing all the evaluation and starting the whole process for the action plan?
Yes, for sure. They can gladly find me at outringtinnitus.com. So that is my website, and I have a coaching program there. I accept new people into my program every month. So I have a cohort every month, and people can apply directly on my website if they're interested.
Sounds good. And this information will be, of course, in the show notes as well. So you can directly click on the link and connect with Frida there. And Frida, what I also like about you is that despite everything you have to deal with for yourself and also helping your clients, we talked about this before we started the interview, that normally everything around tinnitus is perceived very negative. So it's really hard, it's tough, people complain about it, and it's a tough health issue. And you approach the whole thing from another perspective. So you are more positive, helping people, showing them new opportunities, how to deal with it, what they can do, and how they still can enjoy their life like you are doing. And you created a whole positive Facebook community around it. But maybe you can give us some insights on what helps you to stay positive and how it feels to take another approach to the subject.
For sure, 100%. So you mentioned it. So there are a lot of tinnitus communities out there, and it's great that they exist. But a lot of times it feels like people are basically trying to tell each other, like, I'm worse off than you are. This is so horrible. I can't deal with it. But I'm so much worse off than you guys are. And I wanted to counter that because, you know, as you said, wherever you put in your energy in, it expands. So if you put all your energy into fighting tinnitus, it's going to grow bigger and it's going to be a problem for you. So if you address it from another angle, and I'm there to serve the people. I'm there to serve the people because I've been in all of these stages myself, and I know myself that it's lifetime wasted to worry about tinnitus because you can still literally do everything else you want to. In the worst case scenario, you get a hearing aid or even a cochlear implant if your hearing is so severely damaged. But there are tools and ways out there. So tinnitus should really not be a limiting condition. Tinnitus can be there and it can be accepted. You can move on. And for me, that's why I started this positive tinnitus community. And for me, you know, it's also not possible to be positive every day. We all know that. You have good days and you have bad days. I have days in which my tinnitus is like, oh, it's blaring now. Last week, I got the vaccine, my first shot, and my tinnitus was quite loud afterwards. But, you know, I know that it will calm down as well eventually. And I know that it's linked to specific causes when my tinnitus spikes. That's when you call when the tinnitus has a sudden increase. And I know that it's normal to have fluctuations in your life because we all do, right? Sometimes we don't sleep well because maybe even it's a positive reason we don't sleep well. Sometimes we don't sleep well for something that stresses us out. But we know that we have this intrinsic feeling that it's going to be fine and we move on. And this is what I want to tell the people out there as well who do suffer from tinnitus. It's fine. You can move on.
Very good.
That's my message for all the people out there with tinnitus. I'm more than happy to connect and to be of service.
Sounds good. So I will put the information as well in the show notes for the Facebook community to connect
Great.
with Frida there as well. And maybe, Frida, because you seem to be a really positive personality, maybe you have some other lifestyle tips or hacks for us to stay healthy, stay on track, even though someone might be listening who does not deal with tinnitus, but some other health issue or other stressful situation in life. And you mentioned that it's typical that people get it between 30 and 45. And I think this can be a really stressful period in life anyways, because there's so much to deal with. So with parents getting older, having kids and whatever. So, and there's so much pressure from work side, or when you are an entrepreneur, you are always on the run, like you're always under pressure. So it makes sense that there are new challenges. But what are your ideas with dealing with them, staying true to yourself, trusting yourself, and just keeping everything in balance?
Yeah, 100%. The single most effective tool that has helped me in the last, let's say, 8 to 10 years dealing with many different things is meditation. I meditate every day. Sometimes it's a deeper meditative state. Sometimes I can't get past worrying about one single issue, but I still take the time. So, and meditation for me doesn't have to be stigmatized. It can also be you sitting down in the morning with a coffee or a tea for half an hour and stare at a blank wall. And whatever comes up, comes up. You know, maybe you don't have half an hour, but 5 minutes. If you spend 5 minutes listening to yourself, I think you can find a great sense of direction. And I have a favorite quote, which is from Seneca, a Greek Stoic philosopher. And it goes, we suffer more in imagination than in reality. And if we listen to ourselves, we often realize that we do suffer more in imagination than in reality. So my biggest recommendation is listen to yourself, and that will help you a great deal to get your priorities straight and focus on the things that really matter.
Sounds really good. So do you have another tip maybe from the physical side? So would you say that working out, doing any kinds of sports can also help you to decrease the stress levels and maybe put your attention away from the tinnitus for a certain amount of time?
Yeah. Well, apart from meditation, obviously exercise is the single best way for you to raise your serotonin levels, for example, and to literally the best, most natural antidepressant is sports. So if you combine sports and the meditative practice, so I love to go cycling. I used to do race cycling a lot when I was younger. Unfortunately, not that much time anymore because it's very time intensive, the training. But it's been shown also that sports is, apart from, like, let's say, really therapy-resistant depression, one of the best natural antidepressants that you can employ in strategy for you to use in order to, really get out of yourself, you know, to challenge your status quo and to feel proud about yourself, feeling proud about the accomplishments that you've made, and even if it's just a 20 minutes run in the morning or the evening.
Very good. So I'm motivated to go to the gym now again, and fortunately it started this week again, but it was a really nice description on how this can benefit you move your body. Yeah. So the next thing is let's talk a little bit about sleep, because sleep, I think, is also a huge theme, and so many people, especially here in Germany, I think it's 80% or so of the population, they deal with some sleep issues. So whether they can't fall asleep, or they wake up in the middle of the night, or they can't have this deep sleep. And we know that sleep is really important for regeneration and also getting new energy, everything for your mind and body. And I imagine it's pretty tough to have this sound in your ear all the time than to fall asleep. And you mentioned it before, but do you have some strategies, ideas on how it's easier to fall asleep, whether it's someone who has tinnitus or someone who's just stressed out listening right now and wants to have a good night of sleep?
Yeah, 100%. So the same technique that I mentioned earlier, acceptance and commitment therapy, is also used for chronic insomnia patients. And for all of you out there, this is a resource. It has not so much to do with tinnitus, but this is the single most greatest resource that I found, because I've also I've struggled with insomnia myself. So not tinnitus related. So I don't worry so much about my tinnitus, but I do. I'm an impatient person at times. Yeah. So I want to get things done, and I really focus on them. And then obviously, naturally, it's difficult to shut off. So I've had my fair share of dealing with insomnia myself. And there's one resource that I would really recommend to everyone listening if they do struggle with sleep. And it's called The Sleep Book from Dr. Guy Meadows. I'm not related to it in any way, but it is exactly using the tools that I use for tinnitus, so acceptance and commitment therapy, to deal with insomnia or chronic difficulties with sleeping. And it's amazing. It will transform the way you see sleep, the way you go to sleep, because as well as you said earlier, where you put your energy in, it will expand. So if you worry about sleeping all the time, and when you go to bed at night and you're like, oh, I struggle, I worry about sleeping, will I get the night of sleep that I need? Yeah, you know what happens? You trigger your fight or flight instinct, and the natural cause is you won't be able to sleep. So check that resource out. For tinnitus, people with tinnitus, it's a bit more difficult, especially at the start when they start suffering from tinnitus. Then I usually do recommend some kind of sound therapy. So that can be anything from what I mentioned earlier, really buying a sound pillow. So a pillow with a little speaker in there that plays some sounds of your choice. You can use from ocean sounds to bird sounds, or fire cracking or something like that, or white noises, brown noises, etc. Or literally, if you don't want to invest that amount of money, putting your phone on airplane mode, downloading a few songs on Spotify or whatever you use, and play them in a loop, and put a timer, and in order to distract your attention from tinnitus, because it's all about challenging that fight or flight instinct. Because if you are in this fight or flight instinct, and this is a natural mechanism, sleep is a restorative process. We all need it. We're all capable of it. It's a biophysical mechanism that needs no effort. And if we are in this fight or flight instinct, no matter whether it's from tinnitus or from being annoyed that we haven't been able to sleep yet, this is a state that will not let you sleep naturally. So the book is one resource for people with tinnitus, using sound therapy at first, or also employing these techniques. So if you feel anxious, labeling your anxiousness, or if you feel a knot in your stomach, saying like, oh, there is this big knot in my stomach again. Let me see how it feels like today. Yeah, and you shift your attention. You completely shift your attention away from the repetitive emotion and repetitive thought onto something different. And in that way, you will signal your brain, okay, I'm not in danger, and that will allow you to get to sleep. And one last tip regarding this is, even if you can't sleep, try to not to struggle. Yeah, if you lie there without struggling, turning from side to side, tossing and so on and so forth, and being like, oh, I still can't sleep. If you do that, you waste very, very precious amount of energy. So if you can't sleep and you only sleep for a couple of hours at night, but at least you don't struggle, you'll have so much more energy for the day ahead than actually spending half the night awake and struggling. And that's the same. That goes for tinnitus as well.
Thanks for sharing this. I think those were great tips around sleeping and dealing with insomnia. So, Frida, how does it look like to work with you in this coaching process? Because we did not talk about how long this takes where you work with people. So I guess this is a one-on-one coaching you do. So it's really individual. It's not an online class or something similar. So is this like 1 month, 2 months, 3 months, or can people extend this when they feel better and when they notice that it really helps? Or do you have different packages, just to clarify this?
Yeah, for sure. So I like to work with my clients at least for weeks, because that's when I see the biggest change and the biggest benefit. But I have 2 month and 3 month programs as well. They are, right, as you say, very individual, and we continuously tailor the experience to the individual client. So we always look on what's next. What's your biggest problem now? How does it change? How did it change from the last week to today? And obviously this is sort of like what I most enjoy and what most makes me feel grateful, because seeing people progress and getting better and eventually being able to focus on the things that really matter in their life it's great. It's like that reminds me of why I love doing this. I'm in the process of creating a course as well to make it more accessible, but I'll be only releasing a beta soon because I'm still not so sure. Obviously the course will have a different price point and it's more accessible than a coaching program, where I devote my personal energy, but it's maybe more accessible for the broader masses to be able to help more people. But obviously for me, I think I have more control and more a possibility to help you as individually as possible if you go for one of the coaching options. And as I said, they are 1 month, 2 month, or 3 month. And usually we see significant betterments after 3 or 4 weeks. And then the people can decide themselves whether they want to stay or whether they want to move on. And obviously I'm always there for, I've always have my one open ear for them if they need some additional support after finishing the coaching. Yeah.
Yeah, that sounds like great options. Like there's something in for everyone, but still, I think you need individual coaching there as well. It's the same when you are building a very special business. So you need this one-on-one coaching. It's not something that works for everyone, like losing weight. So sure. I think this is a little bit easier. So to package this in an online course. But great that you are offering all these opportunities. And again, I put the link to this in the description. And awesome. Frida, to round this positive episode up, do you have a special nice advice, something that leaves our listeners really inspired for the day so that they are in a good mood, with a good mindset, making good decisions to drive their lives forward?
Yeah, I think I shot a little early on with my quote from Seneca, but I once again would say that if you really got a system for having your back when things go wrong, let's say, so if we go from the quote, you suffer more in imagination than in reality. With my clients, we develop a toolbox that helps them even when the tinnitus spikes or goes worse again, in order to be able to deal with it, And if you feel like you have that kind of back support, you have something in your back that whenever things will get worse, you will immediately be able to enjoy the good times even more, because you're not constantly thinking about the bad stuff that could happen in your back, So let me rephrase it. I think if people, whatever it is that they're dealing with, if they feel like they have an approach of how to overcome these difficulties, to be proactive about them, you have a completely different approach to also enjoying the good times in your life, being with friends, being with the family, going out, doing sports. If you feel like you have an approach to deal with the things that are coming up, that are challenging for you, I guarantee you anything else will also be a lot more fun. And meditate on it, see what's coming up when you sit in quiet, and your biggest difficulties will reveal themselves. And I think that's really the thing that I would like to share most with people.
Sounds really good, Frida, though. I think that was a great help. You had so many tips about meditation, doing physical exercises, moving your body, and finding ways to sleep despite all the stress. So really great episode today. And it was a pleasure having you on the show.
Yeah, thanks so much for inviting me on the show, Jennifer. I think it's great what you do. Thanks very much.